Supraspinous Fascial separation. First, you'll be working on the superficial fascial covering of the nuchal and supraspinous ligaments. It is easiest and best to perform this technique with the person lying supine. However, it's not so easy to see what I'm doing in this position. For training purposes, we may show you different perspectives and use different positions so that you can see my fingers. Place both of your middle or index fingers at the base of the neck on the supraspinous ligament, just below the C7 spinous process. If you are more comfortable using one finger, place your other hand at the side of the head to stabilize it. Now use the pads of your fingers to apply a medium pressure directly to the ligament, pressing on the central portion of the spinous process. Let your fingers sink into the tissue, exerting an anterior and superior pressure. Remain there for 30 to 60 seconds or so, without moving, and then slowly move your hand toward the top of the neck. Move slowly and deliberately, working in the direction of the fibers. It may take you a minute to several minutes to travel the few inches from the base of the neck to the base of the skull, depending on the resistance you meet. If there is discomfort in any segment of the ligament, there will be some resistance. Also have the client tell you if there is any discomfort. If there is resistance or pain of any kind, move even more slowly. Repeat this technique a few times. If the fascia in this area is restricted or injured, your stroke may feel a little painful. If there is extensive injury to the fascia, the movement can be very painful. I recently had a client nearly jump off the table when I performed this stroke with less than a pound of pressure. In such cases, go ahead to the next movement in the protocol, where you'll be working transversely, and use a tiny bit of lubricant if necessary to minimize the drag along the skin and fascia. Working transversely is generally less uncomfortable than working longitudinally. Here you're working across the fascia horizontally, both to the right and to the left. Start by reaching under the person's neck with your right hand so that you can access the left side of the spinous process. Begin at the base of the neck. Place your middle or index finger firmly on the ligament between the outer edges of the C6 and C7 vertebrae. Now use the fingers of your left hand to stabilize the skin. This prevents the skin from moving as you slowly pull to the right. Let your working fingers slowly sink into the tissue and then begin the motion toward the right, moving transversely through the fascial covering. After you reach the other side of the vertebra, switch hands and perform the fascial stretch in the opposite direction. If this causes too much discomfort, use a minute amount of moisturizing cream. After you've performed several longitudinal and horizontal strokes on the superficial fascial layer, you can begin to work on the deeper layers of fascia. Sink your fingers into the fascia and remain there for 30 to 60 seconds before you begin any actual movement over the tissue. This time, exert a little more pressure as you move, and be aware of any resistance you encounter in the tissue. Whenever you notice some resistance, wait in that spot while maintaining the same level of traction without force until the barrier softens and permits easier movement.